everyone, if you have a child with developmental or physical delays, this is your chance to really make this coming school year the best one yet for your kiddos. Janet Miller and MJ Luce are both here with a wonderful organization called Circle of Care Therapy, and you are making such a difference in the lives of kids throughout the city. Thank you for being here.
Oh, thank you. Yes.
What is so neat is first of all, how you work, because instead of having the kiddos come to you, you go to them to provide the therapy.
Correct. Yes. Circle of Care is a home therapy company. And so we go and see the child in their natural environment and work with them and try to get them more involved in their therapy without the parents having to leave and leave their other children behind.
So what types of therapy are we talking about here? What do you cover?
We do a variety. We do speech therapy, physical therapy, and occupational therapy.
Okay, so all of those, and again, within the home. So let me just ask you first, maybe we have some viewers watching right now that maybe are wondering if their child has some type of developmental delay. What are some signs of a speech delay?
For example, the child may not be speaking to the mother or understanding what the mother's saying to them. We have some kiddos that the mom will ask them a question and they just ask the question right back to the mother.
Okay, so that would be a sign right there. Also, a physical developmental type delay. What are some signs of that?
The child might be developing a little off track. And if they don't know what that is, on our website we have a graph that will show where they should be.
You have a developmental chart, and I believe we have that, and I was hoping we could pull that up. I want to give our viewers an idea of what you're talking about. I guess this would be just a map to follow then for parents?
Yeah, just kind of general guidelines. Kids develop different ways, but yes. And so for example, if the child is not sitting or crawling or holding their bottle or writing their name, those are some of the things that we might be able to help with.
Now, what age, if they're going to have some type of delay, what age should we be concerned? Because sometimes they're too young and parents are worrying and maybe they're not supposed to develop certain things so quickly.
They're never too young.
Okay.
We see children when they're 1 month old out of the hospital because they may not be sucking right, and we may see them in the 4 months, they're not rolling over yet. So we see them very early, and we see them all the way to the age 21.
Oh, wow, that's wonderful. So you stick with them and really help them progress. So what areas do you cover here in San Antonio? How far-reaching are you?
We're all over San Antonio, really. We extend to the outer parts of town as well. And we also see patients in Austin, El Paso, Houston, and Dallas-Fort Worth.
Okay.
So we're one of the biggest home health care companies in the state of Texas.
A lot of people worry about finances when it comes to this type of help. Is it covered by insurance? And then what is the sign-up process like?
So we make the sign-up process very easy for our families. We go ahead and help with the referral paperwork. Our therapists are very hands-on when it comes to filling out paperwork. And since it's in your home too, it's basically just an easy process. And then from there, we call the doctor and get everything signed up for the doctor referral as well.
And it is covered by insurance?
It is. We are covered by Medicaid and Medicaid-based insurances, a variety of Medicaid-based insurances as well.
That's good to know too. So if parents are watching right now, I guess the best thing would be just to give you a call. And if they do, and let's say they have concerns, can they talk to someone over the phone that will, tell them yes, their child probably does need some type of therapy, or no, your kiddo's okay?
Yes, they can call, and it really is a good thing when the parents see that and jump on it to help give their child a better start. And the worst case scenario is we go out and do an evaluation and find out the child is doing just fine, and then we have a baseline to go from.
Gotcha. Okay, so here's all the information here. You can give them a call. You can log onto their website. They're also on Facebook and Twitter and Instagram. Hey, very, very nice. And as you mentioned before, it's never too early to get a jump started. And this really can help your kiddo during the school year to really catch up. Thank you both so much for being here.
Thanks for
having
us. This is great.
All right, everyone. And coming up after the break, a whole lot more daytime in the next half hour. Every hour counts.